Welcome to The Explainer. Today we're going to tackle a condition you've probably heard of, but maybe don't fully get: heart failure. Now that term sounds pretty final, pretty terrifying, right? But what it really means and how it's managed is a story of incredible medical progress.
So here's how we're going to break it all down. First, we'll look at what's actually happening with the pump. Then, we'll get into this fascinating but dangerous, vicious cycle of why it gets worse. After that, we'll decode how doctors diagnose it. And finally, we'll walk through the modern playbook for treating it. All right, let's get into it.
So to really understand why this is such a big deal, let's just start with one number: 50%. That's roughly the mortality rate for heart failure within 5 years of a diagnosis. It's a sobering statistic for sure, and it really highlights just how serious this condition is and why getting it right is so critical.
That brings us right to our first section, defining the core problem. What's actually going on inside the body when we say the heart's pump is, well, failing?
Okay, first, let's clear up a huge misconception. Heart failure does not mean your heart has just stopped. That's cardiac arrest. This is different. Heart failure means the heart muscle can't pump blood as efficiently as it needs to. It's not keeping up with the body's demands for oxygen and nutrients. And that inefficiency is what causes all the classic signs, like getting short of breath or retaining fluid.
And you know, the symptoms themselves give us really interesting clues. Think of the heart as having two pumps working side by side. If the left pump starts to fail, blood backs up into the lungs. That's why you see breathing problems, like shortness of breath or what doctors call dyspnea, and especially that classic symptom of not being able to breathe when you lie flat, orthopnea. But if the right pump fails, the backup happens in the rest of the body, and that's where you get swollen legs, or what's called jugular venous distension, where the veins in the neck bulge. A lot of the time, both sides are having trouble.
Okay, so why does heart failure often get progressively worse? Well, it's because the body is an amazing machine, and it tries to compensate. But here's the tragic irony. Its attempts to help actually create a vicious cycle that makes the heart's job even harder.
To really get this cycle, we need to know two quick terms. First up is preload. It's basically the amount of blood that fills the heart's chambers right before it squeezes. You can think of it as the amount of stretch on the heart muscle just before it contracts.
And then there's afterload. This is the resistance or the pressure that the heart has to push against to get the blood out. The analogy of pushing open a really heavy door is perfect. That resistance you feel, that's the afterload for your muscles. For the heart, it's the pressure in the arteries.
So, how do we measure how well the pump is working? We use a super important number called the ejection fraction, or EF for short. It's actually a pretty simple idea. It's the percentage of blood that gets pumped out of the main chamber, the left ventricle, with each beat. A normal healthy heart is usually pumping out somewhere around 55 to 60%. This number is going to be key.
Okay, so here's where that vicious cycle kicks in. When the heart's output drops, the body panics. It flips on all the alarm systems, the fight or flight response, and other hormonal systems. These systems scream at the body, hold on to salt and water, squeeze the blood vessels tighter. But look what that does. It increases the preload, more fluid for the heart to handle, and the afterload, more resistance to pump against. And all of this just puts even more strain on a heart that's already weak. It's a devastating downward spiral.
So with this really complex situation going on, how do doctors make sense of it all? How do they classify what's happening so they can come up with a plan?
Well, one of the first and most critical distinctions they make is based on that ejection fraction we just talked about. There are two main types. You can have HFrEF, that's heart failure with a reduced ejection fraction. This is a pumping problem. The heart muscle is weak and can't squeeze properly. But then you can have HFpEF, heart failure with a preserved ejection fraction. Here, the pumping percentage looks normal, but the problem is the heart muscle is stiff, so it can't relax and fill with enough blood to begin with. So you've got a weak pump versus a stiff pump. Two very different problems.
On top of that, doctors stage the disease itself, from A to D. And what's really fascinating here is that the stages begin before a person ever feels a single symptom. Stage A is just being at high risk. Maybe you have high blood pressure or diabetes. By stage B, there might be some damage to the heart, but you still feel fine. It's only in stages C and D that symptoms start to show up and progress. And finally, for patients who do have symptoms, doctors use one more scale to classify how much it affects their daily life. It just grades things from class 1, where there are basically no limitations, all the way to class 4, where someone is out of breath even just sitting in a chair. It's a very practical way to measure impact.
All right, so we have the problem, the vicious cycle, and the diagnosis. This brings us to the final, and really the most hopeful part, the modern treatment playbook. Knowing all this, how do we fight back?
The goals of treatment are about so much more than just living longer, even though that's obviously huge. It's about improving the quality of that life. It's about reducing symptoms so people can do the things they love, keeping them out of the hospital, and really trying to slow down that whole vicious cycle we talked about.
For HFF, that's the weak pump problem, modern medicine has developed an incredible strategy that rests on what we call the 4 pillars. Each pillar is a different class of medication that attacks that vicious cycle from a different angle. You have meds that block those harmful panic hormones. You have beta blockers that basically tell the heart to slow down and take a breath. You have others that help the body get rid of extra fluid. And a newer class, SGLT2 inhibitors, that provides amazing protection for both the heart and kidneys. Using these together has been a total game changer.
But here's the absolute bottom line. These medications are revolutionary, but they can't do the job alone. Lifestyle changes are non-negotiable. Things like watching your salt intake to control fluid and getting the right kind of physical activity to keep the body strong, these are just as crucial as any pill. It's a partnership.
So, we've seen that heart failure is a really serious progressive condition, but we've also seen how far the science has come. Our understanding and our treatments have advanced like crazy. And that leaves us with this final thought. As our population gets older, the number of people living with heart failure is going to keep going up. The big challenge for the future isn't just about discovering new treatments, but about making sure we can get these incredibly powerful tools we already have to everyone who needs them.